All right, guys, so it seems that the state of New York has replaced one dictator, Andrew Cuomo, with another dictator, Miss Kathy Hochul. But apparently this dictator is better because she's a woman, right? This is a better dictator simply because she is a woman, according to the woke left. However, a dictator is a dictator. And, you know, Miss Hochul is showing early on that she has some authoritarian tendencies, as she basically is telling healthcare workers who are unvaccinated and who won't be vaccinated by the September 27th deadline that she set for all healthcare workers to be vaccinated, that you are replaceable, right? That you will be fired, okay, if you do not abide by our mandate. I'm going to get into this because I think that this policy right here and what they're saying and what they're doing is a direct slap in the face to the Democrat narrative in regards to how they claim they care about people of color and women so much, right? The Democrats love to claim they care about marginalized people so much. However, when it comes to the policies that they really want, all that other stuff, right? The potential discriminatory impacts of that policy, it goes out the window. All of a sudden, that's not a part of the conversation anymore. But it's always the focus of the conversation when it comes to Republican policies, right? Whether it's true or not, by the way, but they always try to make that a focus. So before I get into this, I got to give my disclaimer. I'm not making any claims about the mask, the pandemic, the vaccine, the virus. I'm not making any claims about those things whatsoever. If you have any questions about the mask, the pandemic, the virus, the vaccines, or anything related to this pandemic, please consult your doctor, right? Please consult your medical professional with any questions regarding that. I am not making any claims whatsoever. This is about public policy and about public policy only. I'm not making any claims. Now, I want you guys to watch the news clip of Miss Kathy Hochul essentially telling healthcare workers if they don't follow her mandate, then they will be fired and replaced. Take a look.
Governor Kathy Hochul has a message for healthcare workers who face a deadline next week to be immunized for COVID-19. Get the shot or you will be replaced. Channel 2's Dave McKinley has the latest on this situation. David?
Scott, you might recall the state mandate for healthcare workers to be vaccinated by September 27th in order to keep their jobs was first announced by disgraced former New York Governor Andrew Cuomo back on August 16th, just 6 days before he resigned. When Hochul took over, she said the days of top-down decisions by state government were over. But this is one mandate she has embraced, and it has no test-out option, despite the perhaps unintended consequences that are already cropping up in terms of taxing local healthcare systems. ECMC announced just yesterday expects to lose 400 workers due to the mandate, and several hospitals have plans to pause elective procedures and even maternity services because they, with staffing already stretched thin, may have to fire healthcare professionals who've decided not to get the shot. But despite this, the governor, while visiting the Niagara Power Project, stuck to her guns.
To those who refuse, we will find replacements. We'll be working very closely to have a multi-pronged approach, which I'll be announcing shortly.
She gave no further details on how the state plans to arrange to find qualified replacement healthcare workers in an already tight labor market, but said she would have more information in a day or two. Earlier this week, a federal judge temporarily blocked the state from enforcing any part of its mandate that prohibits religious exemptions. This came after 17 healthcare professionals, including doctors and nurses, who oppose being compelled to get the vaccine in this manner, filed a lawsuit. Dave McKinley, Channel 2 News.
All right, guys, so as you see there, that is the new New York dictator acting like a dictator, even though she promised not to be a dictator. Now, what I find interesting and funny is how, again, in a tight labor market, which was mentioned in this news clip, and the fact that we have reports of hospitals being overwhelmed with COVID-19 patients and having staffing shortages, how is it that this governor feels like they can afford to lose healthcare workers over their vaccination status, right? I find it so interesting how these people can go out here and say that these workers are expendable and replaceable, right? And they can just be fired in a time where we're being told that hospitals are being overwhelmed, right? That they're lacking staff, that they need people, that they need more resources. But yet you're willing to let go of staff, which are technically resources, right, to help fight this pandemic and to help take care of people and to, you know, keep people alive. You're willing to let those people go simply over their vaccination status when you have protective equipment and protocols in place that can be followed, right? I don't really understand it. I don't get it, right? I don't get it. I don't get where this logic is coming from here. You know, if I was in her position, I would probably say, you know what? Listen, we can't really afford to lose anybody right now, right? Regardless of their vaccination status. I think it's better to have, you know, as many healthcare professionals as we can during a pandemic than to not, right? Than to fire those people. But apparently, this dictator, she has a plan to replace those who refuse to be vaccinated. Because a few days later, as promised, she came out here and she basically said that she is going to replace those people with foreign workers. Take a look.
You said yesterday that you were looking into temporary visas for foreign workers to fill these anticipated slots that might be empty in hospitals and nursing homes. So what is that going to look like? Where are these replacement healthcare workers coming from? What's the plan?
Well, I'll start with the last question, see if I remember the first one by the time I get through your probably 3.5-part question, Bernadette. This is something that we have to work with the Department of State on first. And this is a conversation we've already been having to talk about the opportunity we might have in freeing up the visa system to have some temporary workers come from places like the Philippines where many nurses go elsewhere. I literally had this conversation with the Prime Minister of Ireland when we sat where I am right now and talked about, you know, do you have any, everyone I'm talking to, I'm saying, do you have any healthcare workers you can get over to us? But it is going to be a Department of State approval process that we have to work through. So this will not help in the next couple of days, but it would be great if we can, and we're going to be continuing to find ways to adjust our licensing requirements so we can have out-of-state healthcare workers.
All right, guys, so that sounds pretty clear to me, right? She's basically saying we're going to replace unvaccinated healthcare workers that we're going to fire, okay, with foreign workers, right? Foreign healthcare workers. Okay, and for the life of me, I don't understand, how is the left not outraged about this? How are they not outraged by the idea that this governor is about to fire a bunch of women whom disproportionately make up most of the healthcare workers in this country, right? 76% of healthcare workers in this country are women, according to the Bureau of Labor Statistics, right? And people who are minorities, okay? Minorities whom, among healthcare workers, tend to be the most vaccine hesitant. So she's about to fire a bunch of those people and replace those people with foreign workers. And she just flat out says it. But there's no outrage from the left. There's no cries of sexism/racism. But wait, I thought that any policy that has a desperate impact or discriminates against black people or women was sexist/racist. But I don't hear cries of sexism and racism. Now, I mean, we do hear cries of racism from, you know, Black Lives Matter, but not from the mainstream left-wing establishment. We're not hearing that from the left-wing politicians or the mainstream liberal media. The Don Lemons of the world, the Joy Reids, the Al Sharptons, right? The race hustlers, the people that's outraged about the lie of Border Patrol whipping black Haitians at the border, right? They get outraged over any type of racism or sexism, right? They're silent as a church mouse on this. They ain't got nothing to say. In fact, we're hearing from groups like Occupy Democrats, which is supposed to be, I guess, progressive. They support these type of policies that have a discriminatory impact on so-called minorities and women. And I just want to reiterate here, I don't think that the policy is sexist or racist. But what I'm saying is, I just find it funny how you're not hearing those arguments from the left, because they do usually use those arguments, right? They use those arguments all the time when it comes to Republican policies, right? Any type of Republican policy, the first thing they look at, well, does it disproportionately affect black people, right? Does it disproportionately affect women, right? And if it does, then they call it racist or sexist. But when it comes to this vaccine mandate that's coming from the governor of New York, a Democratic governor, I don't hear anything. I don't hear anything at all. Even though the healthcare industry is disproportionately made up of women, right? So who's going to suffer the most from this? Women, okay? So where's AOC? right? I thought she was all against sexism. I thought she was against cis male, heterosexual, white supremacy. I thought she was against that. But when it comes down to this, crickets. They don't have anything to say. Again, I find that hilarious. When it comes to Democrat policies, and this is what I try to tell you guys about Democrats. They can come out here and say their policies are pro-women, pro-black, pro-this, pro-whatever. It's not. What it really is pro-Democrat. It's pro what the Democrat agenda actually is. That's what it's pro. It's not pro-women. It's not pro-people. They don't care about all that stuff. That's salad dressing, right? That's all. It's a distraction. That's all it is. It is a way for them to push their policies without actually really meaning what they say, right? Because if they meant what they said, if they cared about women and people of color as much as they claim they do, they wouldn't be implementing this type of mandate that is going to cost a lot of women and people of color to lose their jobs, right? To lose their livelihoods, to not to be able to feed their kids. And it especially doesn't make sense during a time where these same people are telling us that hospitals are overwhelmed, right? That they need workers. They need as much staff as possible. But you're deciding to fire people over their personal health choices, right? And here's the thing, man. Here's the thing. It's a very small minority of those people who are not vaccinated, right? It's not like it's 50% of the hospital staff and healthcare workers not vaccinated. No, it's like a large percentage of them that are actually vaccinated. And to my knowledge, it seems that safety and protective equipment and protocols are in place to try to help reduce the risk, right? Things that we've been following ever since last year before we even had the vaccines. So I don't know, man. We're talking about a very small minority of healthcare workers who are unvaccinated. I don't really see the point of making those people lose their livelihoods, right? Because they don't want to necessarily follow this mandate, and then replacing them with foreign workers, right? Foreigners, kicking Americans out of their jobs and replacing them with foreign workers, right? Over their personal health care choices. But all we hear from the left is my body, my choice when it comes to certain issues dealing with healthcare, right? My body, my choice. All we hear is we need to protect women and people of color, right? Protect women and people of color. That's all we hear. That's all we hear. But when it comes to this, crickets on this. It's no longer a choice anymore, right? I don't know, man. I guess women and minorities, I guess they don't need jobs anymore, right? Maybe they want to kick these women out of these healthcare jobs, these good paying healthcare jobs, so they can get married to some man and be dependent on a man, right? Maybe women don't need to be independent anymore. Okay, maybe this is what this is about. But who knows? Who knows? Like I said, my mind is blown, but it's also not blown at the same time in regards to how silent the left has been in regards to the potential discriminatory aspects of these types of policies, right? When it comes to sex and race, right? But again, when it comes to any other Republican policy, whether it's actually discriminatory or not, whether it's actually racist or not, it's racism and sexism all day, right? And any other type of ism that you can think of. That's what it is. So, you know, it's almost like these talking heads, specifically those in the media and, you know, the Democrat establishment, it's almost like they're not pro-black or pro-woman or pro-minority, pro-people. They're not pro any of that. They're just pro-Democrat, right? And that's it. That's what they are. They're pro-Democrat. And pro-Democrat basically means whatever policies help the Democrats maintain as much power as they can. So let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.